Welcome to another episode of Medicine Mondays. Today we're going to be talking about a topic that, even though it's heavy, is extremely important. This week marks National Suicide Prevention Week, a time where awareness comes not only from healthcare providers but to the general public. And we're going to talk about a serious crisis here. We're going to talk about how suicide death occurs once every 11 minutes. In fact, by the time I finish this episode talking about suicide prevention, someone will have committed suicide. And it's one thing that it gets a lot of fanfare in bursts, especially when it happens to a celebrity that we all know. And of course, there's always those questions why. Today we're going to talk about some of those reasons why, not all, because you never know what's the final reason, but we're going to talk about some of those reasons why. More importantly, maybe give us some tips on how to recognize it. And then I think at the end we're going to give some information on how to help, especially if maybe you're feeling or suffering from some of these concerns, or if you recognize that in a friend or a family member. So whenever I talk about a topic, I do love to give numbers, because I think when you give numbers, it gives context and allows people to, kind of understand, like, hey, this isn't some rare thing he's talking about. This is something that, yeah, affects me kind of through and through. So let's take a look here. So we have this information from the CDC, right? Nice little graphic from the CDC. And I'm going to read some more information from it. Over 48,000 people died in 2021. And the year 2022, with the early estimates, have already shown that to, unfortunately, exceed this 48,000 number. I mentioned the one death in every 11 minutes due to suicide. And I think what's more important is, yes, you have that number. And this is just United States, especially if we're talking about the CDC. 12.3 million people have seriously thought about suicide. 3.5 million people in this country have made a plan, and 1.7 million have actually attempted it. And I think if we give the breakdown, right, because typically when we hear these numbers, we're saying, okay, who are the people who are committing it, attempting it? What are their reasons why? And which I think are valid questions, because when we have the celebrities, when it occurs to the celebrities, we stop, we evaluate, we analyze what's going on in our life or what was going on in their life, that they say, you know what, it's better for me to commit suicide than to not be here anymore. Like, those are always some of the tough questions. And I can tell you, as a healthcare provider, I've had countless of patients, because a lot of times, for especially, again, I'm not a therapist, but a lot of times for patients, you are like their therapist. You are the one that, hey, you know what, I'm open enough as it is. I'm going to tell you everything. And I've taken care of patients who said, doc, like, I'm done dealing with all of the things I'm done dealing with, all of the stressors at work, all of the stressors with my family, all of the stressors with the disease process that I'm, that I have, right? Because that happens a lot too. I'm taking care of very ill, sick patients, and they're like, doc, I would rather not be here to deal with the same issues with the disease. So it's an extremely important topic that healthcare workers, we should always be wary of. And we should always be asking the questions, and more importantly, asking the right questions. Because a lot of times I've had patients where, we're having just a regular exam, regular discussion. And then I ask some of the right questions, and they just break down, because they've never been asked a question, and now the questions are here, and now they're having to kind of deal with the emotions of, like, oh wow, someone never asked me that, or they never asked me how I felt. Like, I was just coming to get my regular checkup. I didn't know you were going to ask, how's work life, how's life at home, like, is any stress I'm dealing with. I didn't know. And then they just kind of pour out. So I want to talk about, again, just kind of give some more information, especially from just from a statistical standpoint, so we can understand that, again, obviously a lot of times when we talk about suicide, we talk about that finite act, right? Like the last act where they commit the suicide and they pass away. But there's so many other issues associated with the suicide that is far reaching out of it, right? So the CDC mentions that those mentioned of the 48,000 people who commit suicide, for every suicide death, for about 3 hospitalizations for self harm, 8 emergency department visits related to suicide, 38 self reported suicide attempts, 265 people who, again, seriously considered it, right? And this is for every suicide. So, yes, we think about suicide, we think about that final act, but look at all of the other subsequent issues that stem from it. And I think it's important when we think about this aspect of like, hey, one, because I hear a lot, oh, it can never happen to me, or I didn't know it can happen, right? What are we doing to kind of recognize warning symptoms, right? And I love these things right here, right? There are some verbal and there's some behavioral indicators of it, right? So when I'm in a hospital, sometimes verbally is saying, hey, I don't want to do this anymore. And let me tell you, especially for my hospitalists, my medical students, my regulars, whoever's following me, especially from a medical perspective, I never take for granted or I never allow it to be a joke, right? When a patient tells me, like, yeah, doc, I'm done doing this, man. I don't want to do this. I follow up and they recognize my tone turns from comical to serious in a second. Because a lot of times, especially for my men, and we're gonna be looking at some information from a Kaiser Permanente that talked about, again, who's affected more. We're gonna look at some information because a lot of times, especially my men, will jokingly say stuff that they're extremely serious about, but they don't want to be open, right? They don't want that, that window of vulnerability to say, doc, yeah, if it was up to me, I'd be down out here, right? But like, no, like, what do you mean? Like, how serious are you? How much? Like, I go into a mode very quickly because I understand that I may be their only point of contact for support. Like, I dropped the graphic earlier, especially for my podcast listeners. 988 suicide or crisis helpline, where you could just text 988 or call or chat the website, right? Because there's always support, right? We want you to know that there's always someone out here who is willing to talk, because there are emotional signs, there's physical changes, there's, like, especially with social media, there's online changes that occurs. Social media profiles don't get updated, or very ominous messages get posted on social media for the cry of help, right? There's a lot of different things that we have to start thinking about, right? When we say, hey, you know what, is this person someone I should be concerned about? I love, and this is just a kind of list here known on CDC as well. Mood patterns included rapid mood shifts, calmness to sadness, despair, depression. We obviously, the depression gets a lot, but I don't want people to think that those who want to commit suicide or think about committing suicide are just walking around sulking. A lot of times they do a great job in the general public of being able to say and just kind of hide it off, right? Like, let's make sure neglecting hygiene is important. Either issues with sleep, kind of acting on this, right, where like now they can't sleep or they're sleeping too much. A lot of these things, again, they're not like, oh, if you have one or two things, you're definitely concerned with suicide. But there are things, especially if you're a friend, if you're a family member, you want to be keen on, you want to pick up on, because the concern is always there from that standpoint. So let's take a look at this information from Kaiser Permanente, which I think is amazing, right? Just so we can get a kind of breakdown, right? And those numbers I gave, unfortunately, were United States numbers, right? With about the 48,000 here that passed from suicide worldwide, right? And we got this from the World Health Organization. Worldwide, more than 700 deaths are due to suicide. 700,000 deaths per year are due to suicide. For every suicide, there are more people who attempt suicide. Leading cause of death among those 15 to 29 worldwide is suicide. 77% of global suicides occur in low and middle income countries. 77%. Now, of course, obviously, you're in the United States. You're not in the lower middle income country, but just think about that. Think about that number of 700,000 every year when you start thinking like, oh, it doesn't happen as often. And again, I can understand why you may think that, because the typically only time we really hear about it is if it occurs to a celebrity. And I think that's why this week is so important. And in fact, this month, as far as I like, even though it only has a week, I'm just gonna call it National Suicide Prevention Month, right? Because that's why this time is so important, especially because we're about to go into the holidays. We're about to go into that time frame where if you have family, you're going to be around family. But if you don't have family, guess what? Now you're going to be alone. Now you're going to be despair. Now you're going to see a lot of people happy, joyous, and everything else. That's what they're going to be showing on TV. But you're going to be living a life to say, like, oh, I'm not as happy as them. And, no one's going to miss me if I'm not here next year, right? These are the times when you start having these thoughts. So I am happy that we are recognizing it or bringing it to the forefront of people's mental, if they weren't thinking about it for a while. And interesting enough, in this country, death by firearm is the number one cause, but in the world, it's ingestion by suicide, right? Is an extremely important cause of it. Right? So let's just take a look at this information here from Kaiser Permanente, because I think it's important, again, just for us to kind of get some context of who is being affected by this. Who is being affected? Who should we be concerned about? So you have this information here and this looked at information over the last decade, right? So for 2011 to 2022, over 500,000 lives lost to suicide, right? Adjusted suicide rate increased by 16%. So this isn't a problem that is getting better. This isn't a problem that is stable. This is a problem that is worsening. Key takeaways that we're going to look over here at the some numbers, especially for my podcast listeners. We're just looking at some numbers here from the CDC, just so we can get an idea. CDC data shows a record of 49,000 deaths in 2022, which I kind of mentioned. Our earlier graphic was on 2021. So again, the number is increasing. And this is coming after modest declines in 2019 and 2020. And I don't have to tell you what happened in 2020, which is likely leading to this increased cost. Guys, we just came, we're still in pandemic, but like that definitely exacerbated it. Suicide death rates in 2021 were among highest among American Indian and Alaska Native people, males, and people who live in rural areas, right? So I kind of mentioned the World Health Organization about how the majority of the suicide deaths are happening in low and middle income countries. Over here, we have the same issue, right? Where again, rural areas, low income related areas, you're seeing a predominance. Suicide death rates are increasing fastest among people of color, younger people, and people who live in rural areas, with many groups in seeing an increase of 30% or more. I want to say that sentence again and say it slow so we can understand that. Suicide deaths are increasing among people of color, young people, and those who live in rural areas. Suicide death rates have varied, from a state to state issue, right? So again, that's telling, right? That is telling. That is concerning, right? That the groups who are going to more likely be affected by mostly everything, right? When we talk about disease and process and mental health and trying to focus on the aspect of mental health, are those who are being affected more by suicide rates. And they had some great graphs on here. Let me see if I can. Yeah, I can't find it. I can't find it here. They had mentioned some information as far as exact cause, increased stressors, unmet mental health needs, challenges that coincide with 988 launch. And 988 again is that crisis hotline. 988 received almost 5 million contacts, including 1 million from the Veterans Crisis Line. Right. So again, I want us to think about that. We have a problem that is not getting better. Yes, the pandemic definitely played a role. And being locked down and being alone and being with the thoughts, I'm pretty sure it played a role. I'm not going to tell you that it did not, right? Not to say that I'm going to go back and say that, oh, we shouldn't have had lockdowns, because that's a whole nother discussion. But it definitely added to a problem that was already there. It added to a problem that was already there. It added to a problem that even if you don't live in this country, other countries feel this at a much more significant rate. Like I said, we had about 49,000 in 2022 and 700,000 occur yearly, right? So yes, it's one of those things where yes, we get a lot, the whole world gets just as much as well too, right? Where it has it so that suicide ranges between 9 and 14th top leading cause of death, right, in the world. 9 to 14, just depending on the year that you're having. So I want to leave us, right, especially because I think it's important not only to understand, right, this, let me make sure, yeah, not only to understand that yes, we have an issue of concern that we need to address, but we can't be afraid to talk about it. I talk about it a lot on this channel how there are certain diseases that when it comes to kind of that doctor-patient relationship, even then when you have a great one, it's sometimes difficult to get over. Mental health issues is definitely one. Suicide concern is definitely another. And I challenge, I'm talking to my healthcare providers now, right? And again, obviously, friends, family members, you can do this too, but I challenge my healthcare providers because you are supposed to be the leaders. I challenge you to make sure that a part of your line of questioning, a part of your history taking is recognizing, hey, this is an issue I need to address with my patients, whether I'm doing it once a year, twice a year, whatever the time frame you need to do it in, it needs to be done because we can't continue to allow the numbers to continue to rise and us as a healthcare force not talk about it. I'm on, by the time this recording is done, I think I'm on like episode 3. I'm on 300 plus episodes. And this is the first time I have even talked about suicide and suicide prevention, which should give you the idea. Because, and I think a lot of times we put a lot of stress and onus on our mental health colleagues, right? You say, oh, that's mental health issue, right? Oh, it's depression, mental health, anxiety, mental health, right? We want to put so much emphasis on them. But remember, guys, it's not enough of them to take care of all of the mental health needs. We need to step up. We need to step up. We need to recognize when something is awry. We need to be able to be that first line of defense for those who need that defense to happen. So I love this. Just make sure. I love the fact that we have these times, these weeks, these months, because if you're just kind of walking around, you're just in the motion of taking care of patients, you can kind of forget that there are things that you need to add to your armamentarium of weapons to help fight for that patient's most optimal health, right? Because that's what it is. As a healthcare provider, I always say you are fighting with your patient to get them to the most optimal health as you can. And if you're not arming yourself with the information, with the research, the updated research, the factual research to help them become the best person that they can be, then you are doing yourselves a disservice. Now for my non-health providers, right? My non-health, because again, I know that can be a lot of burden, right? Because I don't want my friends and family members to feel like there's some level of burden that they have to take on in trying to diagnose and recognize signs and symptoms. No. But I do think if you start having the conversation, and obviously you don't even have to go straight to suicide, right? If you just start having the conversations with like, hey, I know you're dealing with a lot right now. Is everything okay? And you just pause. And you allow that friend, you allow that family member, to vent. You allow that family member to get whatever they need off their chest. And not to say that you have to be the one to solve whatever problems they bring to you, but sometimes they just want to be able to say what's going on. But recognizing that if you can't, which again, I don't suggest you do, if you can't solve their issues or concerns, recognizing there are people in the back, right? Like I always say, kind of the backup. There are people in the back who are willing to help and support you, right? Like I said, that 988 crisis line, 5 million people contacted them last year. How many lives do you think they saved because they were able to reach out and touch someone, right? And how many lives they could have saved, right? Because if you ask the general population, as a majority, feels that suicide should be something we should be able to prevent. So now the question becomes, are we, right, the healthcare providers, the general public, doing what needs to be done to be able to prevent, that issue concern, right? So again, I know I know those, especially those who rock with me to the end. I know you aren't used to the heavier topics of concern, but I do think and I noticed it myself, I do think I'd be doing a disservice if I don't do what needs to be done, right? So I'm yours truly, Dr. Pierre. Thank you for joining another episode of Medicine Mondays. I'm gonna see you guys next week.